Hi everyone, Dr. David Cullen here with Synergy Wellness in New York City to discuss a torn suprapatellar tendon. Well, what is that? It's a long word. You have an infra and a suprapatellar tendon. The supra is the tendon above the kneecap and the infra is below the kneecap, just as it would insinuate based on the word there. So she has an old torn suprapatellar tendon on the left side, and you did it about a year ago?
Yeah, December.
So in December, okay, so it's almost a year and she's still having knee problems. So a lot of times what'll happen is you have an injury like that, if it's a partial tear, they're gonna send you for physical therapy. So she had a partial tear, they sent her for physical therapy. If she had a full tear, they might do surgery on that, probably more likely to do that. But in this case, they sent her to PT, she rehabbed it, pain got better eventually, which it normally would, but now she's having problems again and she's having left hip pain as well. So I'm gonna show you what we do with a suprapatellar tear or a chronic or an old suprapatellar tear. This even applies to an old rotator cuff tear in the shoulder. So take a look at this. Do you still have that pain when I do this?
Yes, a little bit.
Okay. So she has pain just above her knee when I bend her knees like that and pull that quad tight. I just treated her hip, realigned her pelvis, corrected all that, and it still hurts. So that tells me it has nothing to do with the alignment of her pelvis and what's going on with her hip. The two may be connected, but now that we've corrected the hip and the lower back, it's still bothering her. So now it tells me that it's definitely a knee issue and that suprapatellar tendon did not heal correctly. So we're gonna get that to heal correctly. Go ahead, turn over on your back. And one way we do that is using cold laser therapy. Cold laser therapy heals and repairs soft tissue damage, unlike anything else can. There's nothing else that can heal and repair soft tissue damage. Stem cells claim to do that, and I think we're still waiting for the research on that, but it certainly looks promising. Stem cells, PRP therapy also, but this has been used a lot longer and it's proven. Those therapies are expensive, insurance doesn't cover them. They're controversial. They oftentimes don't work for everybody. There's still a lot of research that needs to be done on stem cell PRP. We're gonna go ahead here and just calm the inflammation down, the swelling, and then after a couple of treatments, once we get the pain to go away for her, we then start focusing on soft tissue repair and healing and breaking up the scar tissue. So she had that partial tear, and after that tear, scar tissue developed. And that whole time she was doing physical therapy, scar tissue develops, whether you like it or not. So now she's got a bit of scar tissue in there, less range of motion in the joint. And what this is gonna do is it's gonna break up the scar tissue, heal and repair the soft tissue, the suprapatellar tendon in this case specifically, and not only increase her range of motion, reduce her pain, but actually heal and repair that soft tissue damage or that scar tissue. And each treatment takes a couple of minutes. It's not a large area to do. So we're able to treat her in 3 to 5 minutes with our lasers. Some lasers are not as strong, so it may take a little bit longer. Treatment times vary depending on the lasers used. So hope that helps answer your question. For those of you that are suffering from a old infrapatellar tendon tear or a suprapatellar tendon tear, or even a rotator cuff tear, and you still have pain years later, which is very common to have that, and limited range of motion, this is a really great therapy that helps to break up that scar tissue, increase the range of motion, reduce swelling, spasms, and heal and repair soft tissue damage. Actually repair it. Nothing else that I know of does that. Thanks for tuning in.